bringing health information warmly and enjoyably. Welcome back to PillMuse. I'm a pharmacist who loves making everyday medication questions easier to understand. And today we're talking about a mistake I see all the time, taking certain medications on an empty stomach. Now, for some meds, it's totally fine or even recommended. But others, taking them without food can lead to nausea, stomach pain, or even ulcers. Worse, some people feel so sick they stop taking the med altogether. So let's go over a few common medications you shouldn't take on an empty stomach. And more importantly, why food makes a difference. Number 1, NSAID, pain relievers. Let's start with one you've definitely heard of, NSAIDs. Things like ibuprofen, naproxen, or aspirin. These are great for pain and inflammation, but they're also notoriously harsh on the stomach. That's because they block an enzyme that protects your stomach lining. So when you take them without food, they can irritate that lining directly, leading to gastritis, ulcers, or even internal bleeding over time. Taking NSAIDs with food cushions your stomach literally. Food acts like a protective barrier. Number 2, Metformin. Next up is Metformin, a medication used for type 2 diabetes. Metformin is incredibly effective, but it has a reputation for causing nausea, bloating, or stomach cramps, especially when people first start it. Taking it with food slows the absorption and makes it much easier on your gut. Extended-release versions help a little, but even those are best with a meal. Number 3, iron supplements. Now let's talk about iron supplements. These are rough on a lot of people, causing things like nausea, a metallic taste, constipation, and stomach upset. Technically, iron is absorbed better on an empty stomach, but in reality, if it makes you sick, you're not going to take it. So the practical advice is, take it with a small snack or some vitamin C-rich food to help reduce side effects. It's a balance between tolerability and absorption. And the pharmacist's job is helping you find that sweet spot. Number 4, antibiotics. How about antibiotics? Amoxicillin clavulinate, you might know it as Augmentin, can cause some pretty intense nausea and diarrhea, especially on an empty stomach. Always take it with food. And doxycycline, that one's known for causing nausea or even burning your esophagus if you lie down right after. That's why I always tell patients, take it with food and water and stay upright for at least 30 minutes. Number 5, multivitamins and prenatal vitamins. Quick bonus, multivitamins and prenatal vitamins. These might seem harmless, but they often contain iron and B-complex vitamins, which can upset your stomach fast on an empty stomach. But here's the good news. Taking them with food not only reduces side effects, it can actually help your body absorb the B vitamins better. You don't need a full meal. Just something light will do the trick. So bottom line, if a medication ever makes you feel nauseous or gives you stomach pain, don't just push through it or skip your dose. Ask your pharmacist whether it should be taken with food. You might be able to fix the problem without switching medications, just by changing when or how you take it. Thanks for watching all the way through. Stay healthy, stay informed, and I'll be back soon with more pharmacist-approved tips and imagery made just for you. You can explore alternate visual versions of this content over on my Patreon. Check the pinned comment for the link. And don't forget to subscribe, like, and turn on the notification bell. It really helps me keep creating high-quality content that supports your health.